a lot of runners are told to stop running because, they get an x-ray or whatever and it says that they have knee arthritis. And I wonder if just to start right at the beginning, I mean, so that it makes sense when you're talking about some of the other mechanisms, what is arthritis? Like when someone says that to a runner, what are they actually talking about?
Yeah, so I would argue arthritis is pretty much going to occur because you were born. Let's say that it's not that influenced by the physical in your life, right? It's these. The definition of, or the criteria for knee arthritis. I don't memorize this stuff. It's obviously you have knee pain. Okay, in the morning you're stiff. There's a stiffness, but it doesn't last longer than 30 minutes. If it's really lasting 30, 60, 90 minutes, then you start thinking that it's not your classic osteoarthritis. Could be something else. There's some change in function, hurts to go upstairs, your range of motion can be decreased. There'll be some bony changes, so the bones will look different superficially. So that's like your classic criteria for clinical knee osteoarthritis. You don't need an x-ray. I think they've just sort of changed the diagnostic criteria. Most doctors would be like, we don't need it, but we'll get one for you. Everyone still gets it. And then on the x-ray, you'll see like more thinning of the cartilage. But again, if you're over 40, even without knee pain, you'll see like 40% of people with these osteoarthritis changes. And so just because you have those changes in the cartilage doesn't mean you have pain. I would suggest that they increase your risk for pain, but it's not destiny. It's not irrelevant. The tissue's not irrelevant, but it doesn't mean you have to have pain, and it doesn't mean you can't get better. And it also doesn't mean that you're doomed. This is the nice research. This is me being an optimist. When they follow people for like 5 to 7 years, when they have osteoarthritis changes and they have pain, most people don't get worse. I think like greater than 80% just stay the same. So it's not always about progression, at least up to 7 years. So to answer your question about like, how is it relevant to runners? This is what I mean about reframing biomechanics here. Like, instead of viewing load and running stress as a force for bad or like a negative, I would view it as a force for good. It's like running, and healthy running to me can sort of help you tolerate those little changes in your joint that might predispose you to a little bit of, to some discomfort and sensitivity. That's the other way to look at it. It's a healthy thing to do. That physical activity is something you should be doing so that you can tolerate these normal age-related changes in the knee. That's the reconceptualization in the past. I'd say it's over the last 20 years. I'm not the first to say this, that's for sure.
I think I know what a listener is going to be thinking. Is when I think of when I think of arthritis, I mean, the image that pops into my head is an x-ray, and I think that's the general perception of arthritis. And I think what you just said is a little bit different. So if we're talking about knee arthritis, I think someone listening to this is immediately going to imagine the knee x-ray. And if they know a little bit more, they might imagine like a loss in space on the knee x-ray, or maybe some extra bony growth stuff. Yeah. And what you're saying is that's not knee arthritis. Knee arthritis is more of a clinical condition that involves, pain, loss of function, and that you're saying may not even require an x-ray to be diagnosed. Yeah. Is that right?
That's it. And usually, and over 50 usually, or 45 is the other criteria. But yeah, that's the thing. That would be like structural or radiographic osteoarthritis. You can have those changes, but plenty of people have those changes and don't have pain. Or you have pain and you have a tiny amount of changes, right? Or someone else has, a shit ton, huge changes on their x-ray, and they only have a little bit of pain. So there's like a poor relationship between the changes. But again, I don't want to, there are times when it is relevant. There are people, like if you're a runner in your 50s or 60s and you've tried a lot of good therapy and your knee still really hurts and you have OA changes, there are times where the surgery is excellent, and you can actually do quite well after it. So I don't want to, like, if you've been struggling with it for years, and you can, this is the great thing, is you can keep running after it. I would definitely consider a knee replacement. If I was in my 60s, tried everything, I couldn't really run at all. My life was, all the things I love to do was influenced. I'd be like, yeah, I'm ready to do it because I want to be more active. So there is a role. It's sometimes relevant, and that's the problem. We just don't always know when.
Would you keep running afterwards if that happened?
Totally.
And we're talking about a knee replacement here, I presume.
I absolutely would.
Why?
Because that's why I got it. To be more active. Otherwise, there's no point.
I guess the loaded question there is it not that they wore out their knee, then they replaced it, and then the surgeon's going to be mad that they go and wear that out as well?
I mean, even to me, so fine, it wears out like a couple of years earlier than it would already. Who cares? So then I get to run for 10 to 15. It's about quality. You know what I mean? It's okay. Or whatever sport I'm doing. I keep changing my sports. I don't run as much anymore. It's skateboarding right now and trampoline. So it's just, there's plenty of, there are a few papers look at people who have these implants, that the replacements, and they're able to run and keep running. So we're starting to do studies now, and you'll hear tons of, if you go online and search like running with a knee replacement, I think there's like a bunch of course, Facebook pages just saying, yeah, it's awesome. I love this. Keep doing it. Like,
yeah, I did actually try and look into the research a little bit on that. It just doesn't seem like there's a lot.
There's not a lot. There's not a lot. J.F. Esculier, he would be a good person to talk to or look up online his work. I think he's getting more into that. He's a running injury related researcher, but in order to, I haven't talked to him about this, but he's doing a lot more knee OA stuff now. That's where the money is.
All right. Okay. So